Welcome to LECOM Health Matters. I'm Melissa Dixon, Director of Communications and Marketing for LECOM Health. Our guest today is Jeffrey Bennett, Director of Medical Imaging at Millcreek Community Hospital and the Outpatient Imaging Center. Welcome, Jeffrey.
Thank you.
Thank you very much for being with us today to discuss this important topic of breast cancer awareness.
Absolutely.
Breast cancer is the most common cancer in women, with 1 in 8 women developing it in their lifetime. Risk factors include aging, later than normal menopause, family history of breast cancer, and having a prior breast biopsy. We're told that self-breast examination continues to be an important tool in avoiding invasive breast cancer. But how important is it for women to get a 3D mammogram? And at what age should this begin?
So a 3D mammogram is going to be the greatest defense against breast cancer in women. It's going to give us early detection of the breast cancer, and that's going to be the best defense of getting it taken care of immediately. Typically, we suggest start getting the annual examinations done around age 36 to 40 years old.
Okay, great. And how often should patients be getting mammograms? Just once a year? Or
once a year, yeah.
Once a year. Does that change if there is a family history?
Yeah, so if you have a first-degree relative, such as your mother, you would want to have your mammogram starting at least 10 years before she was diagnosed.
Okay. And then, but the frequency of it, once you have your first one, continues just annually?
Just annually, annually.
Okay, great, thanks. And do mammograms only detect signs of breast cancer, or do they pick up other things?
They do pick up dense breast tissue and any other abnormalities, but that's what it's there for. Is mainly to look for breast cancer.
Okay. And why can patients have confidence in the accuracy of the equipment here at the Outpatient Imaging Center?
Well, we have the best technology, top notch here, as you can see, our machine. And what this does is it takes multiple images at different angles to give us great detail and give us a 3D image of the breast tissue, which allows us to see in between the dense breast tissue to make sure there is no abnormalities there, which is a lot better than the standard mammography that they did previously.
Okay. And I know that with this new equipment that you have, the new machines, they are a little bit more, they offer a little bit more comfort than the typical or the older processes. Is that true?
I mean, I can't speak from experience, but from what I'm told that they are slightly more comfortable than the other ones. But I can only imagine that it's never going to be 100% comfortable.
Sure. And then, so we stress this among women to get their annual breast exams, but do we also, and the mammogram, but men can also have breast cancer too, is that correct?
That is correct. So if men are feeling any type of abnormalities as well, upon self-examination, we can also do mammograms on men as well.
Okay, great. And then women coming to the Outpatient Imaging Center can get more screenings than a 3D mammogram here. So what else can they get done? And can it all be done in one day? Is it one appointment? Do they schedule several? And what can women get done here at this
Sure.
location? So
if we did the annual screening and we found any kind of abnormality, we would schedule you for a diagnostic imaging, which is a little bit more detailed than the annual screening. And then based upon those images, the doctor may suggest an ultrasound of the area of interest. We would have a look at the images first, and then he would decide after looking at the images if we want the ultrasound. And yes, we would do this all on the same day, same appointment.
Okay. And then just on a separate note, they could also come and get bone density scans.
Bone density scans, and we also have general x-ray in here as well.
Okay, excellent. So it sounds like it's a one-stop shop.
We have everything here.
Okay, great. And then how soon can patients expect to find out the results of their mammogram? And then what are the next steps if signs of breast cancer are detected?
So we get results within 3 days, typically under, but up to 3 days. If there are signs of breast cancer, we would do the ultrasound. And if it is diagnosed as breast cancer, we would refer them to the correct physician.
Okay. So you are the one who delivers the results, or shows up?
Well, the radiologist would give us the results, and then I believe their primary care physician would deliver the results to the patient, and then they would refer them to the correct physician to follow up with their care.
Okay, excellent. And are there any tests for dense breasts that are better than a mammogram?
No, actually, mammography is just going to be the best way to see through breast density.
So it sounds like no matter what, go with the 3D mammogram at all costs.
Absolutely.
Okay. And then 10% of women have extremely dense breasts. How do I know if I have dense breasts? How would I know that?
I mean, you can do a self-examination and sometimes you can feel that, but the annual examination that you have every year is going to be the primary way that you find out, because that is what what this machine is here to do. It is to look for dense areas and to be able to look in between those areas to make sure there is no abnormality other than just densities.
And if I'm a woman with dense breasts, then it can be a little bit harder to locate or it's trickier, right? If I were to have breast cancer, sometimes it can be deceiving a little bit with those dense breasts. Is that correct?
It is. Well, with the, like I said, with the old way, how we did, mammograms, it was with this type of, mammography, since we take so many different images at different angles, we're actually able to see between the breast density and we are able to detect it a lot easier.
So if I am a woman, let's say I've just turned 36 and I have been told I need to have a mammogram. What can I do if I want to get a mammogram here at the Outpatient Imaging Center?
You could just have your primary care physician send a referral over to us, or you could give us a call at 814-868-7890, speak to our team here, and they can give you some further instruction as well.
Okay. And, is a referral required?
Yes.
It is. Okay.
We always need a physician's referral or order.
Okay. Thank you so much for your time.
Thank you.
And thank you for listening. Join us next time for LECOM Health Matters.